Assalamualaikum doctors. In this video I am discussing very important syndrome, that is Marfan syndrome, commonly come on exam. So Marfan syndrome, they are generally tall, not obese, normal mentality, syndromic features and puberty is normal. So they are tall, look the pictures of the boy. Features for gait and back. In gait and back what we find, there is pes planus genu recurvatum. When he stands, genu recurvatum, scoliosis or kyphoscoliosis and capsulate spots. Then about 4 in head, that is thin long face, high arched palate, dental abnormality, overcrowding, supporting aids, hearing aids or glasses. So in the head we find thin long face, high arched palate, dental abnormality, that is overcrowding, and supporting aids, hearing aid or glasses. 4 in the hand, arachnodactyly, look the child hand, that is long fingers. Arachnodactyly, positive Steinberg sign or thumb sign and positive Walker sign or wrist sign. So thumb sign and wrist sign, pulse abnormality, water hammer pulse, hyperdynamic circulation. Then chest and heart we find murmur and scar, not only cardiac but may be scar for tension pneumothorax, chest deformity, pectus excavatum and pectus carinatum. Capsulate spots or bruises, all patients with collagen disease easily bruise. I would like to complete my examination by formal hearing assessment, Byton score for hypermobility. We tell that I would like to complete my examinations, formal hearing assessment and Byton score for hypermobility. I would like to ask the mother about the other family member with the same conditions, because it is an autosomal dominant condition, fibrillin gene, chromosome number 15. Investigation, diagnosis, genetic testing, fibrillin gene on chromosome 15, lab is nothing. So genetic testing we are doing, fibrillin gene, chromosome number 15. Imaging, spine X-ray, MRI because of dural ectasia, echo, aortic root dilatation or mitral regurgitations. We can do chest X-ray plus formal hearing assessment, slit name examination for lens dislocation, that is upward and inward. Remember, upward and inward. Management plan, I will involve the multidisciplinary team, cardiologist, ophthalmologist, occupational therapist, physiotherapist, ENT, geneticist, lies with the school, family psychological support, if needed thoracic surgeon. I will give the advice, that is red flags and advice also. What are the advice? First of all, any chest pain, ask medical advice immediately. Follow up with the cardiac doctor to measure the aortic dimension and protein specific chondrite. Advice for hypermobility, that is strengthening the muscle around the joint. Swimming is good and avoid the exercise that cause additional stretch on joint ligaments. Attention should be paid to appropriate footwear and awareness of the posture to prevent the development of the chronic pain. Use wider pencils as easier to grip as they have difficulty in grasping pen and pencil. So this is about Marfan syndrome. Remember the important signs are thumb sign, Steinberg sign, wrist sign, Walker sign, and chromosome number 15 also we find Prader-Willi syndrome, Angelman syndrome and the Marfan syndrome. Chromosome number 15 3. Prader-Willi syndrome, Angelman syndrome and Marfan syndrome. What is the causes of chest pain in Marfan syndrome? They can be asked. That is spontaneous pneumothorax and dissection of the aorta. Spontaneous pneumothorax and dissection of the aorta. So this is Marfan. Thank you.